Hey everyone, I'm Zhen Du, an assistant professor in School of Pharmaceutical Sciences here at Tsinghua University. I myself are working on developing new technologies to tackle with the challenges of protein therapeutics and vaccines. In this lecture, I will summarize the biologics that are currently under investigation for the treatment of COVID-19. Well, I guess everyone knows what COVID-19 is, so I will start this lecture by a brief introduction of biologics. So, what is a biologic? A biologic is a pharmaceutical drug manufactured in, extracted from, or semi-synthesized from biological sources. Biologics can be, for example, peptides, proteins, nucleic acids like DNAs or RNAs. It can also be viruses or even cells. Some of you might not be quite familiar with this kind of therapeutics, but it is a field growing really fast in the recent years. They can be used to treat a lot of different kind of diseases such as cancers, diabetes, or autoimmune diseases. Compared with the chemical drugs that we are quite familiar with, biologics are larger in size. Therefore, they have different kinds of properties. First, because they are very big, they cannot penetrate into cells. So we can only target therapeutic targets out of the cells. And also it cannot penetrate the GI tract barrier. So unfortunately, we can only take the biologics by injection for most of the time. So how do we use biologics to treat COVID-19? We all know that in COVID-19, there is this SARS-CoV-2 virus trying to infect our lung tissue. When our immune system sees this virus, it just rushes over to help fighting the virus. However, our immune system in this case gets too excited. So it does not only attack the virus, it also hurt our own healthy tissue. In order to treat and manage this condition, we have two strategies. One is to block the virus from infecting our tissue. Or we can tell our immune system to find the right enemy. So now I'll start to introduce the first category, therapeutics blocking the virus infection. Okay, so now let's look at how the virus infects our cells. The SARS-CoV-2 virus binds to a receptor on our lung epithelial cells. And then the virus gets internalized by the cells and release its genomic RNA. And then in the cells, the virus gets replicated and then secreted out of the cell. So remember, we just said biologics cannot enter the cell. So we have to engage our enemy out of the cell. That means we have to tackle with this virus in this virus cell entry process. But how? Actually, our own body has a mechanism to stop the virus from entering the cells. Many of you may have heard the term of convalescent plasma treatment. First, we find a volunteer who has recovered from COVID-19. Then we transfer his or her plasma to a patient with COVID-19. And in the plasma, there are some proteins called antibodies that can block the virus infection. Well, the big question is, how does it work? Actually, right now, it is still too early to say, but we have some experience with previous diseases. For example, in SARS, we all know that SARS is quite similar with COVID-19. Convalescent plasma treatment can increase the hospital discharge rate. It can also decrease the fatality rate. This is from a study of about 50 patients. Now let's look at the COVID-19 case. Currently, there are only 2 publications on the results of convalescent plasma treatment, and they are both quite preliminary. For example, in this results with 5 patients, we can see that convalescent plasma treatment can reduce the virus load and regain the organ function, increase the blood oxygen, and also normalize the body temperature. So the result is quite promising, but we still need to wait a larger scale of studies to have a confirmation of how it really works. Currently, there are a lot of companies and hospitals and academia working on the convalescent plasma treatment. Okay, so now we talked about convalescent plasma treatment, but this treatment has a problem, which is you need to have a recovered patient by your side to transfer his or her plasma to you. But this is not always available, and this is not quite scalable. So can we, remember we just said that in the convalescent plasma treatment, we have these antibodies that block the virus infection. So can we produce large amount of antibodies in drug manufacturers to treat these patients? If we have these antibodies, we don't have to have some donors by our side to transfer their plasma, right? Okay, so let's first see how our body produces antibodies. So when our immune system sees this very fierce virus, they will instruct those kind of cells called B cells to secrete a kind of protein called antibodies that can bind to the virus. Okay, so if we wanted to produce the antibodies that are bind to the virus, we need to choose which one to produce because our bodies produce a lot of different kinds of antibodies. And not every antibodies is born equal. So some of them can block the infection, but some of them may just hang around and doing nothing. So how do we choose that one antibodies that can do the job? This kind of antibodies are called neutralizing antibodies, the antibodies that block the virus infection.